Africa's Ebola border crackdown is escalating fast as governments race to stop a global crisis. Africa's Ebola emergency is entering a dangerous new phase. The current outbreak, centered in the Democratic Republic of the Congo and now affecting Uganda, has already been declared a public health emergency of international concern by the World Health Organization. Officials are increasingly worried not only about the virus itself, but about how difficult containment is becoming in conflict zones, refugee corridors, and heavily trafficked border regions. Unlike some previous Ebola outbreaks, this one involves the Bundibugyo strain, a rarer form of the virus for which there is currently no approved vaccine. That single detail changes the entire risk calculation for governments across the region. Health systems are now trying to contain a fast-moving outbreak without one of the most important modern Ebola containment tools available. The numbers themselves are already alarming. Reports indicate hundreds of suspected cases and rising deaths in eastern Congo, while Uganda has confirmed cross-border infections connected to people arriving from affected areas. Health authorities are warning that the outbreak likely spread undetected for weeks before emergency responses fully mobilized. Border closures are now spreading across the region. Uganda has already temporarily closed its border with Congo in response to escalating fears over imported infections. Emergency travel restrictions, screening procedures, and isolation measures are being introduced at speed as governments attempt to prevent uncontrolled regional spread. Rwanda has reportedly shut key border crossings, while Kenya, Tanzania, and several other neighboring states have intensified airport screening, health surveillance, and emergency preparedness systems. Officials across East Africa are clearly treating this as a major regional threat rather than an isolated outbreak. UNICEF documents released this week reveal that border closures, airport disruption, and movement restrictions are already affecting emergency logistics and humanitarian deployment inside affected areas. Bunia airport closures and transport disruption are reportedly slowing the movement of medical personnel, protective equipment, and emergency supplies into outbreak zones. That creates a dangerous paradox. Governments want to stop Ebola spreading across borders, but health agencies warn that shutting crossings can also push movement underground into informal routes where monitoring becomes far harder. WHO officials have explicitly warned that unmanaged crossings could worsen tracking failures and accelerate transmission risks. The real fear is not just Ebola, it is system failure. One of the biggest underlying fears is that the outbreak is colliding with already fragile systems. Eastern Congo is dealing with armed conflict, displacement, weak infrastructure, mistrust of authorities, and serious logistical shortages. Those conditions make traditional Ebola containment vastly more difficult. Health workers are reportedly struggling with shortages of protective gear, delayed testing, fuel problems, and attacks on facilities. Community resistance and misinformation are also undermining response efforts in some areas, echoing problems seen during previous Ebola emergencies. The outbreak is also beginning to trigger wider geopolitical and economic reactions. Governments outside Africa are already tightening travel rules. Canada has introduced temporary border measures and quarantine rules tied to travelers arriving from high-risk countries, while the United States has expanded screening and entry restrictions linked to affected regions. That matters because once countries begin implementing broader travel controls, the psychological effect often becomes larger than the direct medical threat itself. Tourism, trade routes, aviation flows, and investor confidence can all be impacted long before infection numbers reach catastrophic levels. Why this outbreak feels different? Part of the reason this story is escalating so quickly is because the memories of COVID-era border closures are still extremely fresh. Governments know how rapidly a regional health issue can transform into a global political and economic problem. There is also growing concern that the world's outbreak response capacity is weaker than many assume. International aid reductions, strained health systems, and ongoing instability across parts of Central Africa have all complicated containment efforts. Some health officials are now openly warning that the outbreak is expanding faster than the global response infrastructure can comfortably handle. At the same time, officials continue to stress that the immediate risk to the wider global public remains relatively low if containment succeeds. Ebola is far harder to spread than airborne respiratory viruses, and transmission typically requires direct contact with infected bodily fluids. That distinction remains critical. But the deeper fear is not necessarily a global Ebola pandemic in the Hollywood sense. The bigger fear is a prolonged regional emergency that destabilizes already vulnerable systems, overwhelms local health infrastructure, disrupts movement across East and Central Africa, and forces governments into increasingly aggressive containment measures. Africa could be heading into months of disruption. Preparedness operations are now expanding well beyond Congo and Uganda. UNICEF documents show that multiple countries, including Burundi, Rwanda, South Sudan, Kenya, Tanzania, Zambia, Ethiopia, and others, are already being treated as high-priority readiness zones because of travel and border connectivity. That does not mean these countries are experiencing uncontrolled outbreaks, but it does show that governments and international agencies are preparing for a scenario in which cross-border transmission becomes significantly harder to contain. The next few weeks will likely determine whether this remains a severe regional outbreak or evolves into something that reshapes travel, trade, and movement across large parts of Africa for months. The border shutdowns now spreading across the continent are a sign that governments are no longer waiting to find out.